You are listening to Wellness Wednesday in the Chronic Wellness Radio Show here on CHLY 101.7 in Nanaimo. With me on the phone now is my next guest, Dr. Mary De Vera, who is an assistant professor of pharmaceutical sciences with the University of British Columbia. She is also a research scientist at the Arthritis Research Canada and research chair in medication adherence, utilization, and outcomes. Her current research interests include understanding medication adherence, developing interventions, and examining the use and impacts of arthritis medication among pregnant women with arthritis. She is also a presenter at this year's ROAR, which is a forum on reaching out with arthritis research. Welcome to the show, Dr. De Vera. Thanks for coming on.
Thank you for having me, Sandra.
Perfect. So it is the ROAR event is coming up at the end of the month. Is that correct? On the 20th, is it the 29th?
It is. It's on Saturday, September 29th, here in Burnaby at the Ismaili Center. And just to give a bit of a background about it, so it's actually going on its 13th year. And what it is, it's an opportunity for leading arthritis researchers to share our research to patients in a public forum.
Okay, so that's fantastic. I was just speaking with Dr. Allison Kidd before you came on, and we were talking about all the great research that is going on in the field of arthritis. So this is an opportunity for the scientific community to get together and share some of that research. And this is a forum that is open to the public. Is that correct?
It is. So I think in previous years we've had up to 200 people, so people are welcome. People who want to know more about arthritis, people who want to know more about arthritis research, and aside from the public forum where people can attend, there's also a webcast that's available. So people from Toronto or Montreal can log on and catch it live on the webcast. And we also have simultaneous Twitter chats. So there's a lot of opportunities for people who are attending in person to ask us scientists questions. As well, there's also the opportunity for people who may be attending remotely to also ask their questions via the social media channels that will be available during the event.
That is so exciting to be able to do that. And I know myself, I'm here over on Vancouver Island, so I will definitely be connecting in with the forum online. And it is, it's a great opportunity to have, like you say, not only hear some excellent educational content, but also to be able to participate and ask some questions.
It is, yeah. And I think, because this is Arthritis Awareness Month, and just to share that, in BC, the Arthritis Research Canada is actually the leading arthritis organization that's dedicated to research. And I did a head count right before I called in, and we have 28 scientists, and there's actually 3 sites across Canada, one in Quebec City, one in Calgary, and then the primary site being in British Columbia. So, and the scientists that will be presenting, we are good at what we do. Can I say that?
You can absolutely say that. Please brag.
We are great at what we do. And the research that we'll be presenting is, some of it is coming hot out of the oven. So some of the findings will be, the people attending ROAR will be the first people to hear it.
Oh, wow. That is good. Now, so do you have, I didn't bring in my list of the different topics. Do you happen to have those?
I do.
Oh, good. Who are the different speakers, and what are the exciting topics that we're going to be hearing about?
So because at Arthritis Research Canada, we do such a wide range of research on, helping people with arthritis live with their diseases. So that's what we're hoping to reflect at ROAR. So we are going to have a talk from Dr. Michael Hunt, who is with UBC's Department of Physical Therapy. He'll be talking about assistive devices, so canes, orthotics, and footwear. So I know that's going to be really relevant, in terms of how can we support people with getting better mobility. We have another colleague of mine who's a health economist from UBC School of Population and Public Health, and he'll be talking about like how can we support decision making in terms of contemplating about surgery. So yeah, what kind of information should we present to patients and their physicians so that we can help support that decision? Because I understand for a lot of patients it's a difficult decision to decide whether or not they're going to be getting surgery to replace their knee or their hip.
Absolutely, it's a really big decision.
And then another colleague of mine who just sits right next door, he's going to be presenting studies on, how do patients make decisions if they had an opportunity to prevent arthritis. So that's also something that's going to be presented.
That's terrific. And then, so with this forum, it is on Saturday the 29th.
Saturday the 29th. And so what is the website? Because most of the people listening to this show quite likely aren't in the Lower Mainland. So what is the website that we can go to be able to register? And this is free, of course, right? It is
online,
free.
yeah.
The online version is free. So the website is www.arthritisresearch.ca/roar 2018 webcast.
Okay. I will also put that up on my my Facebook show page, Chronic Wellness Tips, so everyone can do that. Because, like you say, use the opportunity to have a forum and a dialogue and discussion with some of BC's leading scientists in arthritis research is a pretty good opportunity.
It is, yes.
And what is the topic that you are going to be presenting on?
So my area of research is how can we support the safety of medication taking. So a lot of patients with arthritis rely on medications to improve symptoms and to prevent the disease from getting worse. So one area that I look at is medications during pregnancy. So arthritis, there's actually a gender gap where many types of arthritis affect more women than men, and many of them often striking during childbearing years. And historically, women are excluded from clinical drug trials. So when a drug comes to market, we don't actually know whether that's going to be harmful or safe to take during pregnancy. So that also relates to arthritis medications. So the work that I do is looking to see, how taking arthritis medications during pregnancy, how that affects the health of the mom and the health of the baby, because we need to take care of both. And I'll be presenting studies that I just conducted, and some of them I just published, looking at biologics, which are like new arthritis medications that have really changed the course of the disease, and showed that, taking them during pregnancy has actually not led to preterm deliveries or having babies who are small for gestational age. So it's a bit of reassuring data to show that, they can be taken safely during pregnancy for women with arthritis who might be planning to become pregnant or who are deciding whether or not they want to continue taking their medications.
Mm-hmm, for sure. And the whole treatment arena changed with all those biologic medications. It really is quite different.
That's true, yes. And because of that, it's important to really understand how they're used, in populations that they haven't been quite studied in, including pregnant women. So I'm very excited to be able to share reassuring data on the safety and being able to support family planning and pregnancy decisions for women with arthritis who are taking biologics.
Absolutely, that's that is such a good resource to have for women as they're starting to plan their families. When I was gosh, I guess I was in my 20s, and I was in a rheumatologist visit at one point, and they basically told me that, well, you're probably not planning on having any children, are you? And at that time I said, well, actually, I think I might be. And they were cautioning against it. But, look at how the world has changed. Look at how we've got, first of all, patients are more educated and empowered. And then with the research, to be able to have someone navigate through their childbearing years and through a pregnancy with arthritis and be able to also keep their disease managed at the same time, that's really, it's really exciting.
That's really great to hear. And I guess to tie it back to reaching out with arthritis, our ROAR event, it's an opportunity for us to take the research that we've done and put it in patients' hands, because it's not enough that we go and publish our findings in scientific journals. We really need to do the knowledge translation and get the knowledge to the people that will use them and that they will affect the most.
Absolutely. I noticed when I was doing your introduction that you're chair in medication adherence, and that is something that it's really important. And I think that sometimes, I've been talking to different people in groups and stuff, and people stop taking their medication when they start feeling better, but that is, that's not the recipe for success. Adhering and taking our medication properly is one of the things that people, again, need to have the support and the education and the understanding of why that's important.
That's true. And I think you brought up a very good point that, for many people, when they start feeling better, they stop taking medication. So I think there's that disconnect that they're feeling better because the medication is working. So that's some of the things that we're looking to try to understand better, and then how can we support patients so they're getting better education about their medications. And one of the things that I'm working on is actually the role of other healthcare providers, including pharmacists. So I'm in a pharmacy school, so a lot of interventions that I'm evaluating to support medication adherence is how can the pharmacist support the rheumatologist, or how can the pharmacist support the physician, so that the patients are getting complete information about their medications, how they work, and how to take them, and how to be proactive. So if there's any side effects or any time that they're not feeling well, to know that the pharmacist is also available to be able to support the medication taking in partnership with the physicians.
Absolutely, pharmacists can play such a key role in that, and it's that's also really good information to have access to. Just to wrap up, what are some of the things that people would want to participate in the upcoming ROAR, which again is reaching out with Arthritis Research? Why should people attend online or in person?
Oh, it's just a great opportunity to connect with leading arthritis researchers and presenting the very latest research that we have conducted. The information is available. We have a website for it, so it's www.arthritisresearch.ca/ROAR. And I invite people, if you're in Vancouver area, to come on down, or if you're not, then please access our free webcast and interact with us. It's a really great opportunity for us also to bring our research to the public. So we're very excited that we get to have our 13th ROAR event.
Absolutely. I attended one online a couple years ago, and I will absolutely be on the web-based version on Saturday the 29th and joining in, and maybe even have some questions. So I really look forward to participating in the event, and I really appreciate all the work that yourself and others in our scientific community are doing to keep the development of treatment for arthritis moving forward. So thank you.
Thank you for the opportunity to share about our research and ROAR. Thank you.
Excellent. Okay, thank you so much. Have a very, very great day and a successful event.
Thank you.
Thanks. Bye-bye.
Bye.
That was Dr. Mary De Vera, Assistant Professor of Pharmaceutical Sciences at the University of British Columbia. Thank you so much for joining me today on the Chronic Wellness Radio Show. It is something that CHLY is doing every Wednesday with our Wellness Wednesday programming, and it is an opportunity to take some time and talk about health and wellness and living our best lives. Next Wednesday, the fabulous Pam Edgar and the ever interesting Dr. Paula Lake will be in the booth bringing you Wellness Wednesday 1 week from today. I thank you very much for joining me. This has been Chronic Wellness Radio, CHLY 101.7, and I wish you all a really, really great rest of the day. Have a great day. Thanks.